my name's Ray. I'll be one of your nurses.
My name's Stacy.
Can you tell me your name?
Hi.
Hi,
I'm Ashley, the nurse.
I'm
Okay.
Brittany. I'm Nate.
Can you tell me
I'm
your date of
Laura
birth?
Reed. I'm Naomi's sister.
All right, nice to meet you.
Nice to meet you.
Your name's what?
Laura Reed.
Hi, Laura. I'm Alice.
Okay.
Meet you.
All right.
I'm
I'm just
Naomi's
trying.
sister.
Do you know if Naomi has any
We're gonna do an
allergies?
assessment and get some meds to be taken care of. Okay.
Let me think about this for a
What's it say
second.
on the
Okay.
chart over there?
It's not known.
What do you want me to check?
This is
The medical
your
record.
family member?
No,
Yeah.
Reed.
Is it Naomi Reed?
Yes,
The birth date, March 23rd.
she's 38 years old.
No known allergies.
Nope.
I'm checking the IV sites here. It looks like I have a covering on the left and not on the
So we
right.
have
David,
slurred, we have altered speech.
checking
Were
color,
you with her when
infiltration.
When this happened?
Yeah, we were having coffee together early this morning at 6
I'm gonna see
a.m.
if they're
and all of a
hot,
sudden,
red, or
her speech
cool.
slurred, her face dropped,
Anyone have a pen light?
drooped.
Are there
and
two or are
the
there one?
left side got really weak.
Okay.
I knew it could be a stroke, so I called 911
Okay.
right away.
What
So it already shows you.
Oh, you know what?
Does she? Do you know if she's had any recent intracranial or spinal surgeries, head trauma?
Assess my lung sound.
No. Not
Or a
that I
stroke
can
in the
think
last
of.
3 months?
No.
No.
questions.
Does she have a history of intracranial
Oh, no.
pressure? Or hemorrhage?
No.
Or brain aneurysm?
Maybe a little.
No.
Vascular
Maybe it's a little
malformation? Brain tumor?
No.
Alright, so I'm gonna lift them up and listen to the lung sounds on the back.
Do you know if she's having any active internal bleeding?
No,
Under the
no.
gown.
Okay. And no other major bleeding disorders?
No.
Alright, I'll reassess them on the front as well.
Go to the labs.
Okay.
I'm gonna just take your shirt down here. Alright, Naomi? I'm
We're
gonna
just
take your shirt down
gonna,
and
we're just
listen to your lungs.
assessing here. We're listening to your lungs and your heart.
So I'm inspecting, looking for equal rise
We're
and
all
fall.
pending.
Let me check that quick.
Okay, and I'm gonna
So
listen
her,
again.
her CT scan showed that she's had a stroke. So her doctor ordered her some medication that she's not going to be able to give us consent for right now. The medication is a clot buster that,
Yeah, the doctor explained something about RTPA medication, but I still have some questions about it.
well, I will answer as many of them as I can for you, and if not, we will call a doctor because it looks like that you're going to be the one giving her consent for this, whether you would like her to have this treatment or not. This is a very time-sensitive treatment, so we are going to be starting it very soon.
Okay, what is it?
It is a clot buster. What happens is that when she has this endometriosis and oral contraceptives, her pressure got too high and it broke off the clot and went to her brain. The clot is blocking the blood from perfusing the rest of the tissue. So the medication gets in there and it breaks up that clot. It also thins your blood a lot. So we got to make sure that she's not on any bleeding risks. Has she ever had any seizures? Has she ever? All the questions that she asked you about are all contraindicated.
I also have a.
Will it reverse the stroke?
It will not reverse it. It'll just let her get blood flow back.
Alright, so I'm gonna
So
pull this
whatever's
back up for
damaged
you.
is damaged, but we want to prevent further damage from occurring.
I'm just gonna pull your,
Okay. Is
Put her
it
down
a
on the
very
center
risky
stomach.
It is
medication?
very risky because I said it thins all of her blood. So if she has an
okay, so
abdominal wound,
I'm inspecting the abdomen.
She has an abdominal.
why is she?
Looks like we have a, huh?
What about the?
Oh, what about this
We have a
wound over
wound.
here? Ignore
Yeah,
that?
no, we can now like maybe it's just.
I don't think we can do
There's blood
Look,
everywhere.
I'm like, there's a wound?
We,
Oh, all right.
man, you're,
You're all
Get
over
around.
the place.
so you want me to take this off?
Is that the consent?
Nope, I have an information sheet for you on the medication that
Thank you.
you're asking about.
I'll take it.
We gotta believe her.
Are you gonna give us consent to do it?
For the PTI and R stuff.
Yeah, like that reading.
Why is everybody in
Okay.
such a rush to start this
So,
medication by 9 a.m.?
inspecting,
So what happens is that once she comes into the hospital,
Yep.
we have a
Now
very
I'm gonna
specific
auscultate.
time frame for that medication to be effective. If we wait longer than that time frame, it's not going to be as effective for us to give to her.
What if she gets too much? Will she die?
Nope, we can stop it, we can slow it, we can have So what happens is that this thins the blood, and we have other drugs that can make it coagulate if we need it to, but we don't wanna overload her body with that.
Okay.
We already
Thank
did
you
like
very much.
Yeah. So I'm gonna get some paperwork together. Do you have any other questions for me that I can answer?
No, not right now. Thank you for everything though.
You are very welcome. Do you have the consent?
Yeah.
I'm gonna let you do that, right? I'm gonna go get some
Alright, so I have
medication.
normal
So
bowel
you think we're
sounds.
fine?
No distension.
Even if we don't have this stuff, like, we're supposed to double check it? You
With
check
those
this?
stout
I'm gonna
words,
check
right?
your feet.
Yeah, blood pressure.
Pulses.
As long as she's not
It's high.
bleeding from it anywhere,
Yeah.
I think that it's fine.
Yeah.
Equal bilaterally.
It's in here.
And they're strong.
Check 10.
Alright, so we have full belly pulses. Cab refill. I don't know if the cap refill's on.
It might
Did
be
the
just-
doctor explain to you why he believes that she's having a stroke? Or she had a stroke?
What?
It wasn't at
I
first.
just saw it, I just saw it.
I seen it now. Yeah, it's
The
less
nurse
than 3
just
seconds.
I'm checking temperature.
Okay, so you understand.
He said it was from the birth control medication. Blood
Alright.
pressure probably in her legs from the hormones and the endometriosis
And there's the brain.
it launched the blood clot.
Alright, my pulses are full on both arms. Equal bilaterally.
Okay. And do you understand the risks that are involved?
Alright. We'll check these IVs. We gotta check patency.
I can read the risks for you. They include death, stroke, or permanent neurological injury.
Wait, she said she wasn't gonna die.
Do you have a pen light? Yeah. I have what you're saying.
It's not likely, but it is a risk factor associated
Okay, you said it
with
was under
the
neuro.
medication.
Yes.
Okay.
Neuro, 21. is
So
the
can
number.
you stare at the ceiling for me?
Okay.
I'll stare at my pen.
Just a minute. It was right after. Oh, you gotta go to med surge first.
I'm looking for constriction and convergence and accommodation.
She can also have worsening of the stroke symptoms from swelling or bleeding in the brain, bleeding in another part of
Did
the
you hear
body.
me?
Need for blood transfusion or replace blood or clotting.
Yeah, both? Okay.
Allergic reaction.
Could you
to
follow this,
medicine and
follow my
other
pen?
unexplained complications. So when I get my pen back, I'm gonna need to have you sign this for me.
Lag in the left eye?
Here, I got one.
Okay.
Did you already do it?
So we have a lag in the left eye now. We have a lag in the left eye.
Family members to sign the consent.
Constriction and accommodation.
Y'all are really
Yeah.
rushing me on these.
Conversion. That's what I meant. And accommodation. Alright, I'm gonna just look in your eyes. It's gonna be bright for a second. Okay?
And I need to sign this other one, right, as a witness?
Yeah. I was so bad this morning.
It just hit me though. It wasn't like this
Sign this
before.
second part.
Did you just call my name?
Did you just say my name?
Alright, so it looks equal to
Give
me.
that paper, the dosing.
So Pro is equal in both eyes.
Where's that dosing paper? I paid from there. This is the one, right?
Yeah, it looks equal.
Oh, I got that for me. Is
Excuse
this my
me?
10 mLs? This is my 100?
Slowly.
That's what
Wait,
you're
is that the
saying.
machine or is that?
That's activate powder in here.
Okay.
Oh, okay.
So I got slow.
He
Pro.
said
wanna
this
see
is
it.
my 10 ml.
I didn't know it
And this
actually
is my 100. This says 100. Just obviously.
That's
make it
100
60
milligrams,
seconds.
that's your 10 mLs that you'll add to it.
Gotcha. You have to like really hold it there.
Uh-huh. That's cool. I didn't even know what we did that.
Alright, so I'm gonna look in the mouth. Oh, let me get a tongue depressor.
And swab each top. Alcohol. Remove the transfer device.
And he's helping on
Insert the piercing in the vertical.
this.
You already got them, Joe?
Vial of sterile fluid. Done.
Oh, no.
Hi, my name's Ray Hatcher.
Oh.
I'm one of your nurses. Let me just check your
Stop.
Ben,
Alcohol to
Naomi
reduce
Reed,
transfer
date of birth,
device.
9/23rd, no drug allergies.
And insert a piercing.
Alright, so we know she has slurred speech. I'm just gonna check her mouth, looking for obstructions, any bites or lacerations that might have occurred with the stroke.
Transfer device.
Can you stick your tongue out for me?
Almost transfer.
Her tongue deviates to the left. Okay. Do I have any obstructions? Okay. Any broken teeth? Nothing like that. No cuts.
Here's
Okay.
how am I supposed to transfer this?
Okay.
You could do like the
You get the
weird-
cotton swab.
Yeah. Or I could do like the whole and put an object. Like he can't really talk though. Or she can't talk. Maybe an object in the hand. Or let's
I don't
Can
know
you do
what
the,
kind of cotton swab, but I can do it.
he's getting it
Oh.
right now.
How are you
We don't
supposed to
understand,
stand
we're like, how do we get it?
Because it says that there's a double
She is it says she is starting to speak.
Okay, so can I pull it up?
Yeah, I mean,
Put it in there?
yeah.
Okay.
Alright, so I'm just gonna touch your face. I'm just gonna put the cotton here. And you can tell me if you can feel
I
it.
can't pull it up, so I can pull it up, put it in here?
Here, well, squeeze my finger if you feel it, okay?
Is that the
It's
way-
kind of gonna be hard to.
He squeezes with the right side, nothing with the left.
Oh yeah.
Okay.
Okay, so he'll tell you.
That works?
Yeah.
Yeah.
Because I know they can't tell me where it's at,
So
but they
that
can
you
tell me
have
if they
the
feel it,
side
right?
stroke,
So you squeeze with the right side, not the left. Okay.
No, she's got paralysis on the left.
Yeah. So they can't. She can't feel it.
What's the right side stroke?
I'm just
It's so opposite.
going through it. Huh?
Nothing.
Can you squeeze my fingers?
Ray was gonna do
One second. Yes, she squeezes with the right, nothing with the left.
Okay.
Okay.
So
And
got
then-
all this for chart,
what
right?
about-
Can you pull with your feet?
This is not the way this is going down.
Okay. Can you
Medical
push?
world, to your camera, I would have a
So we
double.
have left side
Diffuser.
paralysis and the whole body.
Thank you guys for being so attentive to my sister. I really hope she pulls through this.
Oh, no problem. She will. She'll be fine.
I don't want her to be my nurse.
All right. So,
I know, right?
what is the contraindication on blood pressure?
Theoretically.
She has
180
the
over
paper.
110, right?
It's like that.
Yeah, 180 over 110.
Now we're gonna swirl.
So we're gonna get you some meds, okay?
Disperse them.
Try and
Are they,
just stay calm. We're gonna take care of you,
It's gonna be
okay?
15 minutes.
Ugh. We still are in the times.
Within 15 minutes?
We got a couple minutes.
left. Keep down to that.
They'll make better.
It's like 24 over here.
They better get it.
Clock
My sister
ticking
her
away.
meds.
Wait, tell
Be
her.
right back.
Tell her.
Keep an eye on the baby.
Yep, yep.
All right.
Listen, we didn't have devices, I'm trying to make it work, okay?
Yeah. Well, you got 3 minutes. All right. Just
Oh,
down
let's
your
hear, go
shot
ahead and,
clock.
Right side. Right? Because it's affecting the left side. She has left sided paralysis.
It's nice with those small miles anyway. So.
Yeah, I was like, how am I gonna get it? It's gonna pull it up.
Hi, my name's Ray. One of your nurses. Now you remember me from 2 seconds ago. Just checking your name, name and read, date of birth, 123, and the drug allergies.
She's back.
Wash my hands.
Alright, so my med checks were Activase 100 milligrams. We're gonna dilute it into 100 ml.
Are they gonna get my sister her medicine
Good
too?
point. Was
Yeah, they're getting it right now. They're getting it together.
6, IV bolus,
So,
Go for 1 minute and then 68 over 59.
or
And this
is
is
it-
for
I hear you.
Wait, is the oxygen down?
Naomi Reed, 38-year-old female. Is
She have any
She asked
injuries,
for all
any cuts, anything like that? I'll check the whole body for cuts.
58974. We are starting TPA.
Let me get in here.
Right?
Hey man, I gotta do what I
Let
gotta
me
do.
see your endometriosis.
IV expiration
Alright,
date.
so I'm just looking over the body for any cuts or anything. You may have
Time is 9:45.
that could bleed.
See?
Anything that could bleed.
You got the bolus?
Someone inspect all the skin.
Oh, you may pull it out.
Oh, it's 7 for 6.
Pull it out. And you can give it to him.
Especially the left side, because of her paralysis. Maybe she isn't aware that she hurt herself. So I'll inspect the whole body,
Did she see?
roll over.
No,
No.
he was moving the.
So I don't see anything?
All
Okay.
right, you ready? It's gonna be interesting.
Alright, Naomi. We're getting there.
Pull it in there.
I got my 2 turtles in the other room. Moving in slow motion.
Yeah. Pull up the mark.
I got it. Alright, so what I'm gonna do here, I'm pulling up her 7 loading dose, which is 7.6, and that's gonna be pushed over 1 minute. Hi Naomi, I'm Alex, I'm gonna be your nurse today.
Flush. Got flushes?
Diluted already?
Yeah, it's already diluted.
Okay.
You want me to open this? So it's 7.6. Okay. I don't have a cap for this. Can you get my cap so I left it there for it? Yeah. So I'm doing my second med check. I have Naomi Reed.
Wait, we checked the IVs? We gotta check the
I
IVs?
already checked the IVs whenever I got in here. Alright, I have Naomi Reed, medical record 7658974.
Yep.
Date of birth is March 23rd. She is a 38-year-old female with no known allergies.
Uh-huh.
And I have TPA 100 milligrams of Activase diluted in 10 mLs of normal saline and then diluted in 100 mLs of normal saline. Her loading dose is 7.6 for the first minute, and then she'll get
Just have that in the tube.
68 something.
Oh, you gotta do
68.
Give this one to him so he can see.
That's, you gotta spike it in that one. Sure, I'm gonna put it in there first for you.
First, like it?
You got it. There you
Clamp
go.
it and then bleed it.
Yeah, I know what I'm doing.
Alright, do what you gotta do.
You want first time? Prepping IV?
Oh, the flush.
And my route is IV. My time is 9:45. Right?
No,
No?
not 9:45.
8:45 or 9?
It's 9:00.
Okay. Well, that was my second one, so I'm doing a third one.
Oh, got it.
Naomi Reed, medical record 7658974. You got my MAR. My order is for Activate C orders. My orders were for the first 10 per, the loading dose is 10% of the ordered medication based on 0.9 per kilograms. 7.6 is loading dose. She'll start the rest at 68.74 for 59 minutes.
Yeah, I
59
remember
minutes,
it.
right?
All right, you have a flush.
Flush. Alcohol.
All right, let's gonna
You
clean
need
this.
anything else?
So, Miss Naomi, I'm gonna be giving you a drug here that's gonna help blast up that clot you got, okay?
What'd you say now?
All right.
59 minutes. 60.
Slow down.
All right, I'm gonna load the loading dose over 1 minute.
I can start it now. On my phone.
Can you somebody do my math on that?
Your math?
For the rest of the kilograms that you're gonna be loading that into?
I thought it was 68.
Yeah, it's 60.
It was. I wrote it down.
68 point something.
All right, I'm gonna flush just a little bit.
I don't think we rounded up. We did round up. It was 68.
What's the
68
I could,
in 59 minutes.
I could go double check it.
68
Oh, but
milliliters?
what's the drip?
58 milliliters?
Per hour,
What's the volume?
90 mLs. And hook her up. Where did our family member?
She went to go check this. Right?
Oh.
68.1. Yeah. So 68.
Boom.
I was gonna say, I know we wouldn't have just done 68.
All right, Miss Naomi, I'm gonna put this up here because it's really important that we watch these IVs since this is a high-risk medication. Just want to be able to see everything here.
Alright, so we gotta check. We gotta check the
Your blood
vitals
pressure
in
is-
15 minutes.
Still 176. Do we got her glaucoma? Her glaucoma coma scale?
Well, we
Possible
did
glaucoma.
it,
already did it?
check stuff and
Okay.
it's not, she's got slurred speech, she's got a sluggish, pupillary reaction. She only squeezes on the right side. So you guys have given the
You're
TPA
good.
already?
Oh, perfect.
It's patient included because it is.
It's not heads up.
I know it's not, but I can still put it in, right?
Yeah, move that little piece.
It is open, it's in there.
It's not reading it. It's looking at it. Oh my
It's not
God.
open now. Yeah, no.
What?
use the inside of that one. Where'd it go? He dropped it on the floor again.
What?
The alcohol pad I gave him.
Maybe they should use it. I'm over here doing calculus.
Here.
Your port is cleaned and ready.
The other, oh yeah, I'm looking for the other one. After it's been touched.
Right.
What are you doing?
Trying to close it. What do you mean?
Fighting with it.
Is it clean?
No, it's, yeah, but it's supposed to be clean.
Okay,
It's
what
right
is
there
it?
now.
Well,
Yeah,
y'all
it's
gotta
like
take
it
that
in
new
there.
cap off first.
I know, right? Before we hook it in here.
If it comes up. So is she okay now? Is the clot gone?
The clot is not gone. This is a treatment. So just like whenever you take
There we
medication,
go.
your headache doesn't go away right away. It goes
There you
away
go.
slowly. So we're gonna break it up slowly. Break it up all at once. It'll cause a surge.
Is it open?
Blood?
Is it going on?
Go on.
What's the rate on your phone?
She clamped
68.
68.
What's the volume?
90.
Because the other, I took out the loading dose and then for alarm settings.
Should be running.
Yeah.
It just did it.
Okay.
It's
I
running.
think.
Okay.
So,
Ooh, that
these
was-
running? Set up.
My number's floating up here.
I mean, this thing just, you have to pull it in. Make it pull it in.
Alright, so in 15 minutes, we'll check again, neural, the vitals. See if she,
So you wouldn't give the labetalol until she
180 over 104, I think. 100 and something, 110 maybe.
Is that true? Can we, I thought we.
Well,
could-
no.
No,
That's
that's what it
just a
says.
contraindication for it to med.
No.
Or the nitro.
The order says
Would you
both
give
of
the
those
nitro
are.
if it spikes?
if her blood pressure's up, we give her label.
It's right here.
Label, yes. And if the labetalol doesn't come down after 2 treatments, then you start
Then you do
nitro
nitro.
titrate.
Okay,
Yeah.
okay.
But her pressure never got over 175, so we ain't starting it because the order's for 180.
It says higher than 180 and 105.
Oh, you have it.
Yeah.
This thing, we were gonna be in here with you. I know,
Did I leave my other papers out?
Yeah.
Or is this
These are mine. Well, just this.
Alright, so we have to do blood pressure, heart rate, respiratory
every
rate.
15 minutes. We started at 9 o'clock,
Yeah.
so at 9:15 we'll do another one.
Yeah, okay. The 9:15 starts.
Yep.
So,
Do you have any questions for us?
Those you guys have been absolutely wonderful.
All right.
Just
Did
wait to
everybody
see
else
this
do
clot get
the-
busted.
Do her neuro check?
Oh, her head to toe?
Everything already?
she's got left side paralysis.
You did head to toe already?
Yeah.
Done deal.
Does she have a Foley or anything?
Nope.
She's gonna be ankle.
Sorry, I didn't mean to ruffle your feathers there, Miss Reed.
Yeah, I don't have an order though, right, for full?
I don't think so.
She just have bowel and bladder incontinence. She's doing good on that.
There's gotta be something
I
else.
mean, or the
But
labs
your blood pressure
pending.
went up, wasn't it? 175.
Uh-huh. We can give her a
No, it was 177 when you first.
It's going up.
If systolic BP persistently higher than 180,
Yeah.
despite labetalol, give the nitro.
So you give labetalol 2 doses. You give the first one, you wait 10 minutes, you give the second one, and if it still doesn't come down, then you go into nitro to titrate it drip.
It has to be over 180 to give the labetalol.
Yeah. So,
And it has to be still over.
You just got forward in time an hour and your infusion is done.
My infusion's done, and it's been an hour. So
And
cut
we're
off
check-
our infusion.
have we, I guess we did our.
So we did our checks.
We did our checks.
About to do another one. Hi, Miss Reed.
Alcohol pad. You got another one?
Respiratory.
You can just take it off. All right, I'm gonna listen to your lungs again. We're gonna do another assessment here and see if that
Watching
treatment
for
did
equal
any.
rise and fall. Looking for equal rise and fall of the chest.
That one.
You gotta flush it again?
You have equal rise and fall.
Yeah.
Do you have to flush after you take it?
Do I have a flush?
No.
No, you don't have to.
You don't?
You should as a
I thought
med.
you should,
Oh.
yeah.
Infusion's done.
Safe than sorry.
Lungs sound clear.
Just turn it off.
Yeah.
Yeah, that's what he said.
I thought I turned it off already.
Yeah, you did.
Yeah.
Heart's good.
Did you clamp it?
No.
Before it goes all over the
You
floor.
got that tin light?
No,
Ew.
Grace got it.
It's not the best pen light.
Shut up. It was a
I'm
working
gonna
tin
flash
light.
over 1 minute.
All right, Miss Reed, I'm gonna flash this light into your eyes. Can you open your eyes for me? Miss Reed. Miss Reed.
Hey, Miss Reed. Do a nice sternum rub here.
I got no. She's out. Pressure's good. Miss Reed. Can you hear me? Can you squeeze my, which side was it?
It's the right
Right side.
right
good.
side. Good.
Can you squeeze my hand? All right. Well, now she's
Unresponsive.
unresponsive.
No, I mean she's has
Everything else is good.
Yeah, but
Push her down and-
We need to call our doctor.
Yeah.
We need to call a doctor.
Call somebody, help us.
Alright.
Do we have our labs in?
I don't know. Just
What's her
Try like a
doctor's name?
brachial pinch on her to see if she can feel
Read
anything.
it.